Hi, it's Julie from the MFRC, and thank you for joining us for our fireside chat. It seems like it's been a while since we have been able to come live and talk to you, so it's great to be able to come back to your families, back to your screens. As you remember, it was in March of last year, oh my goodness, that we first started doing fireside chats. We had just closed our doors and we really wanted to find a way that we could stay in touch with you and come to you if you couldn't come to us. And a year later, we are still coming to you and we're very excited about that. The purpose of the fireside chat was really to talk to our military families about the services that were available to you at the PMFRC and the services and the programs that we were going to continue to provide in this very interesting time of restrictions and closures. And we also were very, very fortunate to deal with a lot of our partners. A lot of our partners came on side and really wanted to join us on these sessions to give our families a better idea of the full range of services that were provided, not just by the PMFRC, but also by PSP, by some of our community partners, by the Garrison. And we've just been so fortunate. Today, we also have two guests joining us. Chad Finney and Todd Stride are here from Canadian Forces Morale and Wellness Services, and they are going to introduce themselves a little bit later. But we are also here with Consuela Prue, who are our Information Services Coordinator, and Claudia Beswick, our Executive Director. As we go through, we are going to be talking about different services that are available to our military families to access medical services in a virtual world. We are going to be sharing some links and providing some information. If you hear us talk about a service and you didn't quite get the URL or you didn't get the full name of the service, don't worry. We're going to provide all those links in the comment section below, so it'll be a lot easier for you to find. This is also a live session, so if you are watching us live and you have a question or someone says something you want us to follow up on, add that into the comment section. We'll address that into the end. If you are watching a recorded version of this later on, or if your question is something a little bit more of a personal nature and you don't necessarily want to add it to the comments, we totally get that. Send us a direct message to the Facebook page. We will make sure that we answer that question or refer you to the folks that you need to speak with. Before we start, we have a long-standing tradition of coming to Claudia and asking her about our business resumption plan, what's open, what's closed, any changes that may have happened since we last spoke. So I'm going to turn it over to you, Claudia. What's new at the PMFRC?
There aren't really any changes in what we've been doing over the last couple of weeks. The Northside office is open to the public with proper screening procedures in place and people needing to wear their masks if they enter the building. Deployment parcels can continue to be dropped off. You can go inside the office if you have any questions about the declaration forms. There is a trolley outside if you just want to drop your parcels off. There's also a container for additional wrapping paper and the declaration forms that you need for the parcels. So come on in, drop off your parcels. There are a lot of them that are going out, so this is really good that we're able to continue that service. Please remember, however, that if you are dropping off a parcel, please put a contact number on where we can reach you. Sometimes the post office will have questions and there's something that needs to be filled out in addition to what you have. So please make sure those numbers are on there. And that will eliminate any delay in the parcels getting to where they're meant to go. Porch pickups have started again, and those are happening at the Southside Community Center. So check out the website for the scheduled times and the items and which of the staff members from their respective departments will be there. Watch for signs when you're at the Southside building because you're not going in through the main entrance, you're going in through the side doors, so that those signs are there for that. Employment services, the offices are open by appointment in Petawawa and in Deep River. Email is still the best way to reach the staff team as we're still primarily working from home. As always, if you don't know who you need to reach out to, then please call Angel or Natasha at the front desk and they'll be happy to give you the information or the contact person for whoever you're looking for. So that's pretty much it for us this week.
That's one of the quicker ones we've done. So we'll put the staff contact list underneath in the comments, and we'll also share the main telephone number and email address if that's how you prefer to get a hold of us, so you can ask those general questions. And we'll also share a link to our morale mail guidelines just to give you a couple of tips that you may want to keep in mind before you put those parcels through. But as Claudia said, if you have your telephone number there, we'll be able to reach out for you and maybe help to save you a trip and get that parcel to the person that you need it to get to. It is March. And we are getting to that time in the military family calendar when the rumors start and people start chatting and, where are you going and are you getting posted this year and are you staying? And I think one of the concerns that we hear from families most often when we get into this area and they're checking out potential locations is, are there doctors there? It's one of the biggest challenges that our families face. Can you talk about some of those family challenges, some of those comments, Claudia, and some of the collaborations and partnerships the PMFRC has put in place to help families through that kind of transition?
Right. So there really isn't much that the PMFRC can do about getting access to doctors. We do work collaboratively with local community partners and really appreciate Chad and Todd coming on to talk about access through virtual means, because that, has really made a shift in the last year. But we advocate with our service providers about the unique challenges military families face. We stay connected with the Pembroke Hospital, the Deep River Hospital. We provide information and various briefings that highlight what the realities are that our military families are dealing with. So everything from the frequent moves, ongoing training and deployment, being away from extended family, and the challenge of not having that continuity of care. So the complexities of crossing provinces when you're moving, or when families are on wait lists for specialists, we completely understand. We share that and advocate for that wherever and however we can. We have staff that participate on local committees within the community. We talk about the population that we capture, both military families, veterans, and their families. And we will continue to educate where we can on that continuity of care as it relates to both the primary care with the physician and also with mental health supports for adults, youth, and children. So we know these are ongoing challenges and we're doing what we can as much as we can on that front. We work hard at supporting the families as well, with what we are able to do. We put the various community partners together when we host our forums. So for those of you that have been in Petawawa for a while, you've seen our special needs forum, you've seen our veteran family forum. So the special needs one just happened a couple of months ago. The veteran family one is coming up in May. Part of the objective of the forums is to bring the helping partners together with the families and just share some of the experiences and to talk a little bit about what services are out there and how they can reach those people. So a lot of our forums have been increasing in numbers, and we are actually increasing the number of forums that we're doing because it seems to be a formula that is working for us and for us to be able to also get feedback from the families. From the mental health perspective, we have the Ontario Tele Network system. So that's at the Southside Community Centers. So for those families that need to reach out to their specialists in Ottawa or Toronto, we've been able to do that. And you just need to reach out to Annette Chaquette, who is our family advocacy coordinator, and she will help you make those arrangements with your doctors. And Annette is also working with families who are applying for supporter troop special needs funding. So these are little things that we can do. Doesn't necessarily address the fact that we can't do anything about the doctor situation. However, that's what Chad and Todd will hopefully have some information to share on that front.
Consuela, you and your team are one of our most popular groups at this time of year. A lot of people are hearing rumblings about postings, and a lot of people are coming to you and they have questions about doctors and medical services. What's your best advice that you give families when they call you at this time of year saying, what's it like in Petawawa, other than being a great place to live and be posted?
So
go ahead.
So one of the first things that, sorry, I think we're cutting a little bit. When people contact us regarding family doctors, the first thing that we do is ask them if they have an Ontario Health Insurance Plan card, which is also known as the OHIP. If they don't, we highly encourage them to start the process as soon as possible, because they will not be able to be put on a wait list for family doctor until they have one. Then we explain that in order for them to be put on a Healthcare Connect wait list for a family doctor, that they will need to de-roster from or remove themselves the service of their current family doctor. Once you're on a wait list, it's really important that you call back your care connector at Healthcare Connect if there is any change to your situation. People with health concerns will be prioritized over people that are healthy. Not all doctors and clinics fall under the Healthcare Connect program. Therefore, that's why I always advise families to do their doctor search as they would when they look for employment. Don't be shy to contact the local clinics regularly to see if they are taking new patients. In the meantime, you can still go to one of the 2 emergency rooms in the area. So we have the Deep River and the Pembroke Hospital, and they're both open 24-hour emergency care. Also, if you're a parent of children that are under 18 months of age, you can connect with the Petawawa Centennial Health Center. You will have access to a nurse practitioner for your child. The only requirement is that you live in Petawawa and that you are a military family. If families need to catch up on immunizations, they can access the vaccination clinics through the RCDHU. Lastly, if you cannot access your family doctor or do not have one and have a non-emergent inquiry, you can contact the Renfrew County Virtual Triage and Assessment Center for assistance. It is helpful if you have your OHIP card handy at the time of your call.
Thank you, Consuela. So I'm going to go over to our guests now, because you are the ones that are going to, I guess, give us the information about the virtual services. So some of the things that people may not necessarily be thinking of when they go to a community, they're thinking of what's actually in the community, but there's actually a lot more that's available to folks. But before we start, I'm just going to give you guys an opportunity to introduce yourselves and where you're from and what your role is in the organization.
Thanks, Julie. So my name is Todd Stride. I'm a program director in Canadian Forces Mental Welfare Services. So I work in Ottawa, Ontario, and spearhead different programs to support military families from a national perspective. And I have with me Chad Finney, who largely leads many of our healthcare related initiatives targeted at supporting military families.
Thank you. So the pandemic has changed a lot. And I think that's a blank statement that can sort of cover a lot of things. But one of the things that really has changed is the way people think about doctors and the way they think about medical care. Can you talk about some of the changes that have sort of happened in the virtual remote medical kind of community since the pandemic started?
Absolutely. So if we go back to pre-pandemic in, say, late 2018, Canadian Medical Association had kind of done like a long form study on Canadians' perceptions about virtual care. And we knew at the time that, Canadians were quickly embracing the idea of remote or virtual care. And when we say virtual care, we're essentially talking about a patient and a medical practitioner in 2 distinct locations using technology for an appointment or for contact, essentially, right, for provision of services. At the time, pre-pandemic, maybe 1 in 10 Canadians approximately had used virtual care to date. And it was increasingly getting important and a lot of attention and support for a number of reasons, particularly families in rural and isolated regions. It took away the barrier of geography. So it was convenient and practical for a number of reasons, right? Also time efficient as well. And it took away many of the barriers of care that we were seeing. As soon as the pandemic hit, the interest and of Canadians to use virtual services accelerated greatly, to a point in time where now, a year into the pandemic, 47% of Canadians have had a virtual visit in the past year, which really speaks to kind of the power of technology. There's some limitations. Obviously, a virtual visit can't do everything that a medical practitioner or a physician could do in a face-to-face visit, but certainly has its advantages. In terms of what's available for military families, some of the families listening to this call today may remember that prior to the pandemic, there was actually a pilot in Petawawa orchestrated by the Ontario Telehealth Network that provided billing codes for families who wanted to connect with a physician virtually. This was really primarily for families that did not have a family physician and wanted to make an appointment for a virtual visit. This was good at the time. It had some limitations, but the good news is going now like into the pandemic, the province has really accelerated, as most provinces have, the access to virtual care. So there's a number of options that we could probably go into more detail today, but families have more options than ever, which is good, I think.
So you talked about pre-pandemic and the program that was available. Do you want to talk about bring us I guess, the timeline of where we were, sort of how that sort of wrapped up, the changes came, and where we are now? Maybe you sort of touched on what the services were that are available to families now. Maybe we can walk through those as well.
Yeah, so pre-pandemic, there was like I said, the Ontario Telehealth Network Petawawa virtual pilot, and that program came to close actually 1 April, so it's coming to a close now. But early on in the pandemic, the province made available to all Ontarians with a valid OHIP card, seethedoctor.ca, and we'll put the link in the notes. But basically, this is a service that allows any resident of Ontario with a valid OHIP card to make an appointment to see a physician for a virtual care visit. So very practical. It's available 7 days a week, so readily accessible, and it allows you to kind of carve out a time and space and make an appointment to see a physician in a timely manner. Subsequent to that, in June last year, Canadian Forces Mental Welfare Services made available for all military families virtual care access through a third-party provider, Maple. And it's a program that's distinctly for military families, but it allows military families, not the member, but actually the dependents and children, spouses as well, to access virtual care right away. And the link for that is getmaple.ca/military family. And it's a free service. And again, can be it also allows the ability to get a specialist referral in the provincial system through that service as well.
So those are the two sort of main options that are available now. People have been using them over the pandemic. As we've said, more and more people have started to try some of these remote virtual medical services. What kind of reaction are you hearing from families? Like, how are they enjoying it?
I'll let Chad speak to it a little bit more detail, but the feedback has been overwhelmingly positive. With Maple, Maple physicians have been able to connect with families on average in less than 5 minutes, right? So if you think pre-pandemic, we go to the emergency room if we had a pressing need, or a walk-in clinic, you could be there hours. So for simple things like prescription referrals, a specialist referral, lab requisition, families can get immediate access. So I think the time and the efficiency of the program works relatively well. And now, like with smartphones and iPhones, like just the technology allows really for a visual, some sort of visual capture as well of kind of some of the symptoms and signs that patients are bringing forward. So it's working well. Chad, I don't know if you want to speak a little bit to the feedback and the participation we've had in Ontario today.
Yeah, absolutely. So presently, as we look at the numbers in terms of feedback to the program itself, we're currently sitting at a 96% satisfaction rate amongst all users, and we're over 1,100 visits so far. So at that point in time, families are really enjoying this, and it's because it's removing that barrier access. So when we look at it, 73% of those families are actually using it to renew prescriptions in a place where maybe they can't actually physically access their doctor, or their doctor isn't actually participating in virtual services. Here we're seeing that families are using this service to gain better access in this time where we actually are trying to social distance and keep ourselves safe. So it is overwhelmingly successful for those that are actually using the program.
There are two services that are available there, and I mean, I think it's safe to say that families have their own unique needs and their own reasons why they would choose one versus the other. But are there differences that people should know about why you would maybe choose Maple over see the doctor, or is there a difference between the two services that people should know about?
I think just in terms of accessibility, Maple is immediately accessible. Right, so seethedoctor.ca is good, but I think if you're the type of person that you want an appointment in your calendar and you're not maybe ready to see a physician right away, that works well. It's a free service, again, with both are free, but Maple allows like instant access, and Maple still has the ability to refer you back into the provincial system for specialist care.
And to access the Maple, you would need what?
You would just need a valid CFOne card.
So you wouldn't necessarily need to have the OHIP card like you would for the See the Doctor.
Yeah, which is a good point, Julie, because it works well. Maybe if you're a family who's newly posted in and you don't have your OHIP card right away, you're maybe from another province. The one qualifier that we ask for is the CFOne number, because that is basically proof of affiliation to the Canadian Armed Forces. And if you don't have a CFOne card, if you call our family information line, that's manned 24/7, we can provide you with a temporary code as well, an access code.
So we're going to share the number for the family information line in the comment section and let people know that. So if you fall into that category and you don't have your CFOne card, just check the comments afterwards, and we are going to have that there.
Julie, just to further what Todd had said, one significant difference between the two programs is that the Maple program offers services 24 hours a day. So those overnights between midnight and 7 a.m., Maple will actually be able to provide you service during that time, whereas you see that the doctor may not actually be able to provide you with that kind of service. So if you're actually trying to figure out whether or not the emergency room is a place where you want to go and spend your valuable time, it may actually be worth, going to Maple and getting that visit first and getting that information to see. Ultimately, that being said, if it's an absolute emergency, don't hesitate, call 911, go to the emergency room. But if it's something where you need a prescription or something, or that might actually help you or prevent you from needing to go to the emergency room, Maple's there to actually provide that kind of service so that, you don't need to go to spend, the countless hours sitting in the waiting room. So that is one distinct difference between seethedoctor.ca and the getmaple.ca/military families.
Is there
And let's be honest, the law of military families say that if your child is going to get sick when you are solo parenting, it will be after 10 o'clock when nothing else is open. Like that's going to be when it's going to happen. So I think that's an important difference to keep note of. Claudia?
Just wondering, for either of the programs, is there accessibility to bilingual doctors? So will a Francophone family be able to access that service in their language of choice?
Yeah.
Question.
So seethedoctor.ca, they specifically outline on their website their hours of operation for bilingual services. So they outline that there. Maple, you can connect with a bilingual doctor at any point in time. You just may be delayed depending on the time of day in which you access it. So if it's in the wee hours of the morning, you will still be connected. It's just dependent on the availability of Francophone or Anglophone physicians at that time. So your connectivity rate may be, instead of being 2 to 3 minutes, it could be maybe 5 to 10. And depending, if they're readily accessible, you may even notice no difference whatsoever. So you can choose your language of choice, French or English.
Awesome.
As with everything else with the virtual services, I mean, they can do a lot of things, but obviously there are some things that these services can't cover. Can you talk about what some of those limitations might be that families should know about?
So I guess the big thing is anything that would necessitate a face-to-face visual, visual contact, or any further testing that couldn't be done via technology, right? So there's some limitations. The other big thing is prescriptions. There are some limitations around controlled substances. And that's important too, right? Like, so that, you think someone living with a mental health illness or injury or challenges, that there may be some limitations of what it can do there. It may, for certain prescriptions, it will necessitate a face-to-face visit. But certainly as a first step, the Maple or Go See the Doctor can be a conduit to that face-to-face follow-up visit, right, within the provincial system.
That's perfect. Consuela, is there anything else that you sort of want to talk about? Any other questions that you might have that you have heard from families?
You guys have really touched on pretty much everything we hear, so nothing comes to mind right now.
Before we go ahead, we talked about the fact that this is sort of the posting season, and maybe this conversation has got your questions started, and you're starting to make your list. And if Petawawa is on the list of places that you might go, Consuela, can you talk about who they can reach out to if they have questions about medical services or schools or anything else in Petawawa? Even if you're not posted here yet, who can they reach out to if they have questions?
So the information services team is accessible Monday to Friday, 8 a.m. to 4 p.m. We will have all the contact information listed. We also have, let's say it's after hours and you want to start looking into the area, we have a virtual welcome package that you can access on CAFconnection. And we just recently added a recording of our Welcome to Petawawa info session. So that's always a bit more information than just the welcome package. But please don't wait until you get here. Reach out. We're happy to help, and we'll help you through your transition.
And I think one of the things that we have talked about on this call many times, and I'm sure everybody will back me up on this one, don't be shy. Oftentimes you're not entirely sure if this is am I the right person to be calling, and maybe they don't really do this. Call us anyway. If we are not the right person to talk to, we will try our best to hook you up and connect you with the people that you do need to speak with. We are more than happy to do that. We've answered a lot of questions over the years. Consuela's team has a long list of resources and different organizations in the community. So chances are we've heard it before, and we're more than happy to point you in the right direction. But as Claudia likes to say, no door is the wrong door. So don't hesitate. We would much rather have you call us and do a little bit of legwork for you than have you sit there and not get the services and the supports that you need. Before we end, is there anything else that anybody wants to say before we go? I'm going to give one last chance to.
I would just say thanks, Julie, for the invitation. It's been a pleasure to chat. The one thing I would just add is, like you said, the healthcare landscape is constantly changing, and each community that a military family could be posted to is a different ecosystem, right, with different access points. But reaching out to the MFRC is a good starting point, because there's a good chance they've been asked the questions. You folks have been asked the questions multiple times and built up that subject matter knowledge, right? Like of the community, right? So, like to your point, connectivity is key. To Consuela's point as well. Reach out. There's a better chance they understand that ecosystem, or at least to direct you in the right path. So.
Absolutely.
And there's 32 MFRCs across the country, and they can all be found on their links on the CAFconnection website. So even if you don't know which MFRC you're more closely geographically near, then call any one of them, and no doubt in my mind that they would be happy to set you in the right direction.
And for the folks that don't know, we talk about our website all the time, CAFconnection.ca. It's a national website, so you probably have it set so it goes automatically to Petawawa because you live in Petawawa. That totally makes sense. There's a bar at the very top where it says Petawawa, and if you click on it, there's a drop-down menu. So that's going to show you the list of all the MFRCs. So you can sort of pick the base that you are going to, and you're going to get the services that are available there. So CAFconnection is that one stop for any of the MFRCs that you may be looking for, and you can toggle back and forth between them. Thank you all so much, folks, for joining us. We really appreciate you spending time with us. This is a big issue for folks. I'm saying in Petawawa specifically because that's where I live, but I know for military families across the province. So we really appreciate you taking the time to share that with us. Sometimes we have like a very narrow focus of what we know about doctors and what we've seen in the past. And there's been so many changes and so many developments. And I think for a lot of families, maybe this is the solution that they have been looking for. And it's going to take a little bit of stress off their plate because they know that there is some access to medical services for them that maybe they didn't see in the past. Join us next week. We are going to be back, and we are going to be talking about our new homework squad. It's a program that we are starting with our second language programmer, and she's going to be talking about the services that are available if you are a parent and you want to support your child learning a second language. You may not speak that language, but you still want to be able to be there to help and to assist with that. We are going to talk about this new program and some of the resources that we have available. School is happening a lot more online, I guess, like medical services. So there's a lot of things that we can do as parents to facilitate that learning process. And we're going to talk about some of those next week. So join us next week. Thank you, Todd and Chad, for joining us, Consuela and Claudia. Add those questions to the comments. We will be sure we get back to you and get you the information you need. Thanks again.
Thank you.